Are you or a loved one being discharged from the hospital, but you're not sure whether you should go to an acute rehab center or a skilled nursing facility? Choosing wrong can cost somebody months of recovery. This video can literally save somebody's life. I'm Dr. J, a physical therapist who's worked with thousands of families making this decision. Let's break it down together. Most people don't know this, but a skilled nursing facility and acute rehab center are not the same thing. A skilled nursing facility, also sometimes called a SNF, is a step down from the hospital. It provides nursing services and some therapy, but it's usually less intense. Think a few short therapy sessions a week. An acute rehab center, sometimes called inpatient rehab, is a more intense, short-term therapy facility. Patients must tolerate 3 hours of therapy per day, PT, OT, and sometimes speech. So what's the difference? A SNF is for someone who can only tolerate basic therapy but can't yet return home. Acute rehab is for someone who can participate in at least 3 hours of more intense therapy but still need full inpatient support. If your loved one can walk to the bathroom with help, don't settle for a skilled nursing facility. Also, if your loved one was walking before they went to the hospital, can follow basic instructions, can safely participate in 3 hours of therapy a day, and is motivated to improve, acute rehab might be the better option. Why? Because they'll get more therapy more often and be home sooner with better function. There are times when a skilled nursing facility is a better move. Here's how to tell. A skilled nursing facility may be a better move if your loved one can't sit up for long periods of time, has frequent medical issues like low blood pressure or needing supplemental oxygen, is too weak or confused to follow instructions, needs wound care, IV meds, or complex nursing. SNF care is slower paced but still important in stabilizing someone before they come home. And these 3 tips can literally change the outcome of your loved one's recovery. Number 1, advocate for the right level of rehab. Don't let a skilled nursing facility be the default just because it's easier to get into. Ask, can they tolerate 3 hours of therapy? If yes, push for acute rehab. Number 2, be there at discharge meetings. Medical teams often decide where a patient is going without the family present. Show up, speak up, and ask why they're recommending a certain level of care. Number 3, don't rush discharge if they're not ready. If your loved one is confused, in pain, or declining, ask for another day. You can appeal discharge decisions or ask for more help from the case manager. But if you see any of these signs in a skilled nursing facility or acute rehab center, it's time to take action fast. Therapy sessions being skipped or shortened, no communication with the family, soiled clothes, or hygiene concerns, sudden decline in alertness or appetite. These are signs your loved ones may not be receiving proper care. Remember, you can request a transfer to a different facility. Don't wait for things to get worse. Here's what your loved one's day-to-day activities look like in a skilled nursing facility versus an acute rehab center. In acute rehab, 3 hours of therapy broken up throughout the day, doctor visits daily, and family conferences to review goals. In a SNF, therapy usually once a day, sometimes less, more downtime in the bed or the wheelchair, doctor visits less frequency, and nursing more focused on maintenance rather than progression. The level of engagement is totally different, and it matters. Also, don't assume your insurance covers the best option. Insurance often pushes skilled nursing facilities because they're cheaper. But if your loved one qualifies for an acute rehab center, you have every right to advocate for that. Ask this question, do they meet criteria for acute rehab? You can also ask to see the documentation that's being used to make this decision. If you're denied, request an appeal. Every extra day of higher level care can save you weeks of recovery later. Want doctors and nurses to really listen to you? Say these exact words. I'm the primary caregiver, and I need to understand the rehab plan. Use language like this that shows you're informed and engaged. What's the goal for mobility this week? What's the discharge plan and timeline? Who do I talk to if I feel like they need more therapy? Show up, ask questions, take notes. Respectful persistence gets results. You might be the only reason your loved one recovers. Your voice as a caregiver is powerful. You see things others do not. Whether it's fighting for the right rehab level, catching the red flags, or showing up when no one else does, you are making a difference. And if no one's told you lately, thank you. You matter more than you know. If this helped you, like this video, share it with someone going through this decision right now. and follow along. And remember, the Happy Manor is here to support people who care. See you in the next one.